Hey everybody, it is Wellness Wednesday, and I want to talk to you about, are you toxic? And this may not be what you're thinking. You might be thinking more about toxic personality, toxic, I don't know. Let me know in the comments what you think of when you hear the word toxic. However, toxic can also mean that your body is full of chemicals and things that are clogging you up and making it difficult for your body to run efficiently and optimally. And so, if you haven't considered this for yourself and your health before, you absolutely, if you care about yourself and your health, need to be aware of how toxic the world is these days. And a friend and I were actually talking about this recently, talking about ways to detox. And, there are things out there that you can certainly do to help your body, despite all of the, again, exposures and toxic chemicals all around us in the air, in the water, in our certain personal care products that we use. And I'm going to talk a little bit about that so that maybe you have a better idea if you're not already aware. But let me know that you're tuning in and where you're tuning in from. I am going to start off by sharing with you a study that was done in 2009. I encourage you to look it up, and you should be able to find it easily by just Googling 2009 study on the umbilical cord of newborns. And you will find that, I believe it was the Environmental Working Group, EWG, did a study, and it found over 200 toxic chemicals in the umbilical cords of newborns. And of those 200 plus chemicals, many of them are chemicals that are linked to cancer and also damage to the developing brain. And so if you have not heard of this, you are not aware of it, it should definitely be a concern to you. Whether you have children yourself, if you work with children and care about children, or you have grandchildren, or just simply kids that you care about in your life. As you've probably heard from me, if you've tuned into previous videos that I've done, I've talked about, the rates of special needs, the, numbers of kids that are being diagnosed with things like autism and learning disabilities and stuttering, dysfluencies, neurological conditions, ADD, ADHD, you name it. It's everywhere. If you talk to someone that you know who is in special education, in a job that works with children, I would imagine you should ask them and see what their experiences have been. But I would imagine that you would find that there are a large number of children with many needs, and sometimes they have a lot of behavior challenges depending on what they're dealing with. And so these toxic exposures should be a concern to you. I would like to share with you one of many stories that I could probably share with you about a child that I had worked with in the past for speech therapy. And what I recall is that this was a younger child, I believe was in kindergarten, and the team had expressed concerns about not only his speech, I believe, but also, his ability to focus. And I believe the child had some signs that were similar to a child who might be diagnosed with autism. And so the team was trying to figure out what was going on and what services this child might qualify for. And I remember very clearly that this child had been looked at for heavy metal testing, specifically lead testing. And it was discovered that this child had high lead levels. And then it was being looked into deeper, thankfully, about where did he come in contact with all of this lead. And I have had other situations or children where families have looked into this, or maybe their medical providers thankfully alerted the family to that as being a possible factor in their child's health issues. But again, the question, very important question, is where is this lead coming in? Where are these heavy metals coming from? Well, there have been reports of, lead in baby food. There have been, just look it up, Google it, and I'm sure you'll find it. So there are many possible exposures, and you might think that you're really a clean, have a clean lifestyle. But as I shared in the study, about 200 chemicals being found in umbilical cords of babies. And that was back in 2009, 13 years ago. And I hate to say it, but I don't think it's gotten any better. I think it's only gotten worse in terms of the lack of accountability and the lack of safety for our environment and and in our communities. And so basically, you could have been exposed to a number of things in utero before you were even born. And so, we're seeing, high rates of challenges, health challenges and learning challenges in babies and young children, but because of all of this. So, just to give you an idea about, I said about lead, and that can be found in personal care products, that could be found in foods, that could be found in the air, in the water supply. I'm curious, have you ever looked into the quality of the water where you live? My understanding is every municipality, at least in the state of Pennsylvania where I live, they are supposed to have a water quality report that you can request and look at what contaminants have been found in the water. My concern is, even though there is that report, like what is actually being done about what is found in the water supply. There have been cases across the country of, I think Flint, Michigan is one of them, where people had to advocate for safe water for the people of that town. And, it's a shame that people here in the United States, we have a lot of situations where, there's concern about other countries and helping other countries that are more remote. Let's say, like, for example, a country in Africa not having a clean water supply, and, certain organizations donate money or request money for you to donate. But here in the United States, it's a real concern. If you really understand and know what's going on, you will know that the water supply in this country, even though we have access to water, it's not just about having water, it's about what's in the water that you're drinking. Because if you're drinking more water, like a lot of people, might say to you, oh, are you drinking enough water? And while water is important, you can't be downing a bunch of toxic, polluted water and expect to have good health, right? So I would encourage you to look deeper into that particular subject as well, and talk to your local municipality or where you're getting your water from, and ask important questions about what actually is in your water supply. It might be a bit enlightening and a bit frightening at the same time. So I just am wondering, how toxic are you? Have you considered that? Let me know. And toxicity, you might wonder too, like, well, what would that look like? Well, toxicity can show up as your body is really exhausted and tired. Yes, a lot of people are stressed out, but you can be even more stressed out if your body is all clogged up, like I said, and full of toxic chemicals. Your body cannot work as efficiently and as optimally. I already mentioned the lead, the heavy metals. That's a huge concern. Glyphosate and Roundup pesticides are toxins that have been talked about for quite some time. There have been lawsuits out there about those particular chemicals, yet as far as I know, they're still being used a lot in our country. And it's very concerning that, with health in general, that so many companies and big corporations making products and chemicals that make them a lot of money, that there's, from what I've seen, a lot more concern about making money and a lot less concern for our safety, our public safety. And if you just look at the rates of chronic disease and illness, including cancer, and most diseases are related to inflammation. that can be caused by toxic buildup in the body, this should be a major concern, and should be addressed, and should be in the news more readily. Wouldn't you agree? So if you are, aware that there are toxins, but you want to do something about it, and you understand that there are things that you can do about it. Like, you can't just keep putting them in your body, and expect that the situation and your health is going to improve. And any little thing that you can do can make a difference. And so, if you would like some support with that, understanding, first of all, what toxins you're likely being exposed to, where they are found, what type of products you're currently using, we could look at that more closely and in depth. You would like to look at ways to be able to safely get some of those things out of your body. I would be happy to see how I could support you in that. And I do offer wellness consults, intensive wellness consults, where we dig deeper into your specific holistic wellness needs. And looking at toxins is a very important aspect of health that needs to be looked at. So that could be addressed in a consult. And then health is a journey. So it's been about 7 years for me of healthier living. And part of my health journey was understanding what I teach my clients, which is, again, toxins, awareness about toxins, where they can be found, and changing my habits, my lifestyle, the products I'm using. And so in my health programs, I'm able to help people make those shifts and changes. And I offer a 3-month program. So it's something that for most people, it needs to be worked on over time. And it is a journey, but it's so worth it, because your body can finally breathe a sigh of relief once you have stopped putting all of the toxins in, and you're able to clear them out. If you have digestive issues, you definitely need to be looking at this aspect of your health. Thank you so much for tuning in, and message me, or you could put in the comments here, toxic or toxic soup. And a lot of us are sadly swimming in toxic soup within our body, and we don't even know it. We just know the symptoms that we're experiencing. So thanks for tuning in, and let me know, put in the comments, or you put toxic soup in the comments, or message me privately, and we can set up a wellness consult to dig deeper into this subject. All right, have a great Wellness Wednesday and rest of your week, guys. Bye.